15th, 2024, and I hope everybody's having a wonderful day today so far. Today, I want to talk about pancreatitis, like I was saying in yesterday's video. And also, like I was saying in yesterday's video, pancreatitis is something that I've had many times. Last year, I was in a constant state of pancreatitis for like 6 months. I had a total blockage in my pancreatic duct, and they couldn't get through it. I had multiple ERCPs, I think a dozen ERCPs last year. While they tried to get in there, they were placing stents. My pancreas had gotten so swollen that they had to go, and I had a bunch of cysts that had grown on the outside of my pancreas as well. So they had to first go in there and put stents into the cysts to drain those off, to get the inflammation down so that they could access that pancreatic duct. They had to put a stent on the tail end of my pancreas so those pancreatic enzymes could actually drain out of my pancreas, because they were just getting stuck in my pancreas. And like I said, I had to have those ERCPs for them to do that, and they put those stents in the tail end. They put stents into the cysts, started draining that off, and once the inflammation got down enough, they were able to dilate my pancreatic duct. They put a balloon inside of there, expanded it, and then they placed a stent. They actually placed, like, I think 3 or 4 stents in there over a period of time. I think it was 4 stents. They would place one, and then I'd go back. They'd have to pull that out, and then they put 2 in there. And what they were trying to do was, you know, if this was your pancreatic duct, they were just basically placing things in there trying to expand it. And it took the whole year for them to get that opened enough to where this past spring, they finally removed the last stent out of my pancreatic duct, and I haven't had one in there since. But pancreatitis is it's horrible, and unfortunately, when we drink, you know, excessive amounts of alcohol, you know, our chances of getting pancreatitis are very high. Now, there are more causes of pancreatitis. I just want to preface this today with alcohol or alcoholism or AUD is not the only cause of pancreatitis. It's not. As a matter of fact, smoking is one of the main contributors to people getting pancreatitis now. But alcohol is right behind that, and like I said, there are many other factors which we'll get into in today's video. And basically what I want to do is I want to start today's video off just kind of talk about what pancreatitis is, what are some of the signs and symptoms of it, and then I just want to kind of talk about my experience with pancreatitis and you know, what I've been through with it. And you know, this is one of those videos that, you know, I say this all the time, but if you're looking for a reason not to drink, you know, I will discuss certain topics and say, you know, this is a good reason not to drink. This right here, I promise you, from somebody who has had a ton of experience with this, you do not want to end up with pancreatitis. I'm sure there are going to be a bunch of people here on this channel who have dealt with pancreatitis. I know there's a bunch of subscribers who have had pancreatitis. Love to hear your stories in the comments. I would like there to be a place for people to go in the comments and read about other people's experiences with this, because I promise you, pancreatitis is horrible. There are so many reasons why, but the pain alone that you end up with because of pancreatitis, I promise you, it is one of the worst things that you can deal with. And the thing is that when you end up with pancreatitis, you know, you would think that it just makes your stomach hurt, but it doesn't. You know, your pancreas sits back behind your stomach, and it radiates to your back, and you can get like shoulder pain, back pain, and it hurts so bad that, like, I was flopping around on the ground like a fish because my back hurts so bad. But once again, we'll get into that in a little bit. So, what is pancreatitis? So pancreatitis is a disease in which your pancreas becomes inflamed. The pancreas is a large gland behind your stomach and next to your small intestine. Your pancreas does 2 things. It releases powerful digestive enzymes into your small intestine, and it releases insulin and glucagon into your bloodstream. These hormones help your body control how it uses food for energy. Your pancreas can become damaged when digestive enzymes begin working before your pancreas releases them, and this is what is called autodigestion. Those pancreatic enzymes help break down our food, and when they get trapped inside of your pancreas, it will start to digest itself. those enzymes are very powerful, and when they get trapped inside the pancreas, they have nowhere to go. And what they do is they just start breaking your pancreas down. It starts destroying the cell walls, which can lead to all kinds of other problems, which we'll get into here in just a second. So, what are the types of pancreatitis? So there are two types. There's acute pancreatitis and chronic pancreatitis. Acute pancreatitis is a sudden inflammation that lasts a short time. It can range from mild discomfort to severe life-threatening illnesses. Most people who have it recover completely after getting the right treatment. In several cases, acute pancreatitis can cause bleeding, serious tissue damage, infection, and cysts. Severe pancreatitis can also harm other vital organs such as the heart, lungs, and kidneys. Chronic pancreatitis is a long-lasting inflammation. It most often happens after an episode of acute pancreatitis. Another top cause is drinking lots of alcohol for a long period of time, which I did. Damage to your pancreas from heavy alcohol use may not cause symptoms for many years, but then you may suddenly have severe pancreatitis issues. So what are the symptoms of pancreatitis? Well, moderate to severe pain in the upper part of your belly that goes to your back. And when they say part of your belly, so your liver's on your right-hand side, your pancreas is on your left. So right around below your rib cage on your left side, mid to like center of your stomach, kind of. That's where you're going to get that pain at. Eating may make it worse, especially foods high in fat, and I can definitely tell you that is true. Fever, heart rate, higher heart rate, nausea and vomiting, swelling, and tenderness in the belly. Symptoms of chronic pancreatitis, which is, I have chronic pancreatitis. I've had acute pancreatitis so many times that I finally ended up with chronic pancreatitis. And, once again, this is something that you don't want to get, because once you have chronic pancreatitis, you got it for life. And, your pancreas can flare up anytime. Your stomach hurts all the time, loss of appetite, constant nausea, but the pain in the stomach, and you have to be careful about every single thing that you put in your mouth after that. I'm telling you, it's horrible. But these are similar to those of acute form, but you may also have constant pain in your upper belly that radiates to your back. This pain may be disabling, and I'm telling you, it is. Diarrhea and weight loss, which I've dealt with, because your pancreas isn't releasing enough enzymes to break down food. Upset stomach and vomiting, which I've dealt with over and over, and the nausea. I have constant nausea. Fatty, oily stools that smell especially bad and leave film in the toilet. So pancreatitis pain location. Pancreatitis pain usually starts in the upper, middle, or left part of your belly, and it may spread across your back or up your left shoulder blade, like I was talking about. It'll go from your middle of your back, left side of your back, up to and it feels like somebody's like chopping you in your shoulder. It can feel like it's going deep into your body. It usually comes on suddenly and then steadily gets worse, and it may last for days, and it's true. Certain body positions or activities can also affect the pain. You may feel worse if you lie flat on your back, cough, or exercise. It may help to sit up straight, lean forward, or curve into a ball. And I can tell you that curling into a ball is one of the things that I found that worked best for me when I was in the middle of pancreatitis. Leaning over, grabbing your legs, and just kind of holding yourself like that is one of the best ways I found to kind of, and I would rock back and forth when I would get it. Pancreatitis causes. Acute pancreatitis causes include drinking lots of alcohol, gallstones, autoimmune diseases, infections, medications, metabolic disorders, surgery, and trauma to the belly. And one of the things like with surgery is if they accidentally touch your pancreas in the middle of a surgery or something, that could trigger pancreatitis. And also another thing is that if you end up with pancreatitis, you're probably going to be dealing with ERCPs, and that's where they go down your throat, and they use those scopes and tools to go into your pancreas. When they're in there, every single time that you have to have an ERCP, you have to sign a piece of paper that states that by them doing these procedures that it can trigger pancreatitis, and that they want you to be aware of that, and that that by doing this, it can cause pancreatitis. And I have had, from having ERCPs, I have had them trigger pancreatitis, where I had to be hospitalized for days after the ERCP, and it was just supposed to be outpatient procedure. And when I woke up, I was in so much pain that I had to be admitted, and ended up staying a couple days in the hospital because I was in so much pain. And one of the things about it too is that, you know, just because I'm thinking about it right this moment, is that when you are in the middle of pancreatitis, one of the most important things that they can do for you is to give you fluids, because you can't eat or drink anything, and you need fluids. Getting those fluids, boluses, it can help with the pain tremendously, and it can help the inflammation in your pancreas go down. So if you think that you're in the middle of pancreatitis, this is one of the most important reasons that you need to go to the hospital, so that they can get you on an IV. I can't tell you how important it is to get that IV. Pancreatitis can be life-threatening. If you think you're in the middle of it, please go see a doctor or go to the hospital. It doesn't take a lot for them to figure out if you have it, and if you do, you need to be hospitalized, because it can be life-threatening. Chronic pancreatitis causes include cystic fibrosis, family history of pancreas disorders, gallstones, high triglycerides, long-time alcohol use and medications, which mine was long-time alcohol use, and multiple cases of acute pancreatitis that I found out about. I didn't know that it was pancreatitis during the period of time when I first had it, but after being hospitalized pancreatitis, and then I said, oh my gosh, now that I know what this is, I had pancreatitis probably 20 times before I'd ever been hospitalized for it, and I'm not kidding. So pancreatitis risk factors. Several things can cause you to have a greater chance of having this condition, including heavy drinking, 4 or more alcoholic drinks per day, smoking and vaping, obesity, have a BMI of 30 or higher, especially if your weight is mostly around your belly, diabetes, which is something I have too, and I didn't know about it, high levels of triglycerides, which is high cholesterol, having a family history of pancreatitis, which I don't know if I have any family history of it or not. I've never heard anything about that. Can pancreatitis cause complications? And before I even start reading this, it absolutely can. So I'm about to dig into this. And diabetes, if there's damage to the cells that make insulin. And I think that's why I ended up with diabetes, was because of the amount of damage that was caused to my pancreas because of all the times that I had pancreatitis, wasn't hospitalized for it. I didn't do anything about it. Infection of your pancreas, kidney failure, weight loss, which I've had. I've talked about this. I used to weigh 250 pounds before I got sick, and I don't weigh that anymore. Last time I weighed myself, I weighed 145 pounds. And there was a point in the height of when I was ill, I weighed like 110 pounds at one point. Malnutrition, if your body can't get enough nutrients from the food that you eat because of a lack of digestive enzymes. Blockage of bile ducts. Pancreatic necrosis, when tissues die because the pancreas isn't getting enough blood, which I have necrotic tissue on my pancreas, which is one of the reasons why they might be removing my pancreas. My pancreas shrunk in half in the matter of like 3 months, from January to April of this year. They had done MRIs, looked at it, then they did MRIs again, and my pancreas has shrunk by half. The one thing is that my doctor told me, this is my pancreatic specialist and surgeon, said that you can live with 20% of your pancreas. So, you know, there is some good news there, but I have so much necrotic tissue in my pancreas, and it's been damaged so badly. You know, another thing they're really worried about is, you know, that I might end up with pancreatic cancer. Like, my chances of ending up with that are like really, really, really elevated. Problems with your breathing when chemical changes in your body affect your lungs. Pseudocysts, when fluid collects in pockets on your pancreas, they can burst and become infected, which I've had numerous. I had one cyst on my pancreas, pseudocyst, that was 7 centimeters long, and pancreatic cancer. How is pancreatitis diagnosed? So this is what I was saying. It's not that hard for them to find out if you have pancreatitis. One time I had pancreatitis, I called my doctor. I'd been sick for like 2 or 3 days, and I knew something was going on. And I told my wife, I just want to wait, because I'd already been in the hospital for pancreatitis like twice at this point, 2 or 3 times. And I was pretty sure that's what it was, but I just wanted to wait a couple days just to make sure, because I did not want to spend another couple weeks in the hospital. And I just kind of hung out, laid in my bed for a few days. And I said, okay, I called my wife and I said, we need to go to the doctor. And she called my GI. My GI said, I want you to go to this hospital, go get your labs done, and then come straight to my office. He said, because there's no point in you walking in here without your labs. I had my labs. We went straight from that hospital, which was a whole thing in itself. I'll never forget that day. I was so sick, and we went in one part of the hospital. We had to walk all the way to the other. I remember being so weak. And that's one of the things about pancreatitis. It makes you so weak. And you're throwing up, and you just can't stop. And we had to walk from one side of the hospital to the other to get to the lab to have my blood work drawn. And we were waiting outside the lab to have my blood done, and I got sick and had to walk outside and threw up all over the place. And one of the nurses walked out there and asked me if I was okay. And I wasn't, but I said I was. And after I got done, we went straight to my doctor's office. We sat down. He walked right in the room and said, you need to go straight to the emergency room. I mean, they knew right away that I had pancreatitis, which I haven't even gotten to it yet. But they can look at your lipase numbers and your and another one too, and I can't remember what it is, which I'll get to here in just a second, I'm sure. But I know lipase is one of them they can check. So to check for acute pancreatitis, the doctor will probably press on your belly to see if it's tender and check for low blood pressure, low fever, and a rapid pulse. To make a diagnosis, your doctor will test your blood to measure two digestive enzymes, amylase and lipase. So it's amylase and lipase. High levels of these two enzymes can mean you probably have acute pancreatitis. They'll also test your blood for white blood cells, blood sugar, calcium, and liver function, which is another thing too. One time when I went to the doctor, I was really ill. This was when I went to the hospital in Columbia, South Carolina. I'd gone to one of the Doc in the Box places, and the doctor did a check on my blood sugar, and it came back like 400. And that's when he told me, you need to go straight to the hospital. And I hadn't eaten in days. And I was in the middle of pancreatitis during that period of time. So anyway, also your liver functions will start, your liver numbers will be out of whack, like majorly sometimes. Not my bile duct, but my gallbladder was distended really bad during one of those episodes, and they were actually talking about removing my gallbladder. They wouldn't let me eat. I was NPO like every single day, because every morning they'd come in there and say, you're probably going to have your gallbladder removed today, which they never did, because I was in the hospital with ascites, I got septic. They were just too afraid to cut on me. But I had ended up getting jaundice. My bilirubin numbers were through the roof. It was just a mess. My urine had become completely dark brown. So we talked about them taking your amylase and lipase. High levels of these two enzymes can mean that you have acute pancreatitis. They'll also test your blood for white blood cells, blood sugar, calcium, and liver function, which we already read that. To diagnose chronic pancreatitis, x-rays or imaging tests such as CT scan, MRI may show whether the pancreas is calcified. Your doctor will take blood samples and check your stool for excess fat, a sign that the pancreas is no longer making enough enzymes to produce processed fat. You may be given a pancreatic function test to see how well the pancreas releases digestive enzymes. You may be also checked for diabetes. Other tests can include ultrasound, CT scan, and MRI, which make images of your pancreas to show the extent of inflammation, causes such as bile duct problems and gallstones, for complications like cysts. And another thing that can happen too is like you can end up with a gallstone because your gallbladder and your pancreas are basically in the same area, and a gallstone can fall from your gallbladder and get lodged into your pancreatic duct. And when that happens, it blocks those pancreatic enzymes from escaping, which causes autodigestion, which can cause pancreatitis as well. So once again, it doesn't have to necessarily be from drinking. It could just be something simple as a gallstone that gets lodged in there, and then serious problems. And once again, this is another reason why you need to go to your doctor or your hospital, because if that's the case, they might need to do an ERCP. They go in there, they locate that there's a gallstone in there. They can do a quick hour-long surgery, remove that gallstone out of your pancreatic duct and like potentially save your life and save you a whole lot of problems. So other tests include ultrasound, CT scan, and MRI. I'm sorry, I just read that. ERCP, in which your doctor uses a long tube with a camera at the end to look at your pancreatic and bile ducts, like I was just talking about. Or they can do a biopsy, in which your doctor uses a needle to remove a small piece of tissue from your pancreas to be studied, which I've had like 2 biopsies on my pancreas done, and they were done during ERCPs when they removed those. In some cases, your doctor may test your blood and poop to confirm the diagnosis. It's funny they use this term here. You would think they would use feces, but they may also do a glucose tolerance test to measure damage to the cells in your pancreas that make insulin. So how is pancreatitis treated? Treatment for acute pancreatitis. If you have an attack of acute pancreatitis, you may receive strong drugs for pain. You may have to have your stomach drained through a tube placed to your nose. If the attack is prolonged, you may be fed and hydrated intravenously through a vein, like I was talking about earlier. You'll probably need to stay in the hospital, where your treatment may include antibiotics if your pancreas is infected, intravenous fluids given through a needle, low-fat diet, or fasting. You might need to stop eating so your pancreas can recover. In this case, you'll get nutrition through a feeding tube and pain medicine. And let me tell you something. They're not going to let you eat anything for at least a week if you're in the middle of pancreatitis. You can't eat, can't drink. They will allow you to use these like little sponges on a stick. It almost kind of looks like a lollipop, but you can use it to kind of wet your mouth up a little bit. But they won't let you eat or drink anything until your pancreas is completely calmed down. That's what I'm saying. You need to have an IV, because you still need to be hydrated. And I'm telling you, you're going to want to be on pain medicine. And going to the hospital, they're going to make sure they're giving you intravenous pain medicine, which works instantly. And I can tell you like this. I've been in the hospital multiple times with pancreatitis, and even with the pain medicine, there's been it barely even touched the pain. I had to ask the nurse for bags of ice to place them on my stomach and on my back, heating pads to put on my back. And even then, I was still in a bunch of pain. I mean, I was screaming bloody murder a couple of times I was in the hospital because my stomach hurt so bad. And this is with them giving me IV pain meds, morphine, Dilaudid, all the whole thing. And it wouldn't even touch the pain sometimes. It would be so horrible. If your case is more severe, your treatment might include endoscopic retrograde I'm not even going to try to pronounce that, which is ERCP. A procedure that involves the insertion of a tube down your throat into the stomach and upper intestines to take out gallstones if they're blocking your bile or pancreatic ducts. A small cut is made to remove stones in the bile duct, or a plastic tube called a stent is inserted into the ducts to relieve obstruction, which I was talking about earlier. Gallbladder surgery if gallstones cause your pancreatitis, and pancreas surgery to clean out fluid or dead or diseased tissue. Treatment for chronic pancreatitis. If you have this type, your doctor will focus on treating pain while guarding against possible addiction to prescription painkillers. They'll also watch for complications that affect digestion. You may be placed on pancreatic enzyme replacement therapy to restore the digestive tract's ability to digest nutrients. This will also likely reduce the frequency of new attacks. You might need insulin to treat diabetes, which I have to take insulin every day. Pain medicine. Pancreatic enzymes to help your body get enough nutrients from your food. Surgery or procedures to relieve pain, help with drainage, and treat blockages. Injection of anesthetics into the nerves near the spine may give pain relief. If the pain does not respond to medication or nerve blocks, your doctor may use surgery to remove the damaged pancreatic tissue, but only as a last resort. So how do you prevent pancreatitis? Based on many cases of pancreatitis are caused by alcohol abuse, prevention often focuses on limiting how much you drink or not drinking at all. If your drinking is a concern, talk to your doctor or healthcare professional about an alcohol treatment center. A support group such as Alcoholics Anonymous could also help. Other things you can do to reduce your chance of having a condition, including stopping smoking, following the doctor's or dietitian's advice about your diet, and taking medication your doctor prescribes. So the takeaways are: Pancreatitis is a painful condition that happens when your pancreas becomes inflamed. The two types are acute, which comes on suddenly, and chronic, which is long-lasting. The main risk factors for ongoing over-abuse of alcohol and gallstones, although other things can play a part, such as family history, trauma to the pancreas area, and infections, among others. The disease is highly treatable, but complications can be life-threatening, so early diagnosis and treatment are critical for recovery. Alcohol use is one of the main risk factors, so limiting how much you drink or not drinking at all is key to preventing it. So, the thing with pancreatitis is that, and that's basically all the information on it right there. The thing with pancreatitis is that it can also cause ascites, which the first time that I was hospitalized with pancreatitis, I ended up with ascites, and it was like one of the last nights I was in the hospital. The nurse had come into the room, and this was a new nurse. I hadn't had her yet. She came into the room and told me, and she said, you got ascites. I didn't know what that was, and but I did notice I had some fluid buildup in my stomach. And she said that's from liver disease. And I was like, I got really upset with the nurse, and I told her, don't try to diagnose me. You're not a doctor. Please stop, because you're scaring me. But come to find out, you can actually get ascites not only from liver disease, but you can get it from pancreatitis. Now, how that's caused, I'm not exactly sure, but I did get ascites once from pancreatitis. And the thing is with pancreatitis, it can be life-threatening. It can cause serious, serious complications. Not only is it painful, but it is very, very, very dangerous as well. A lot of people lose their lives because of pancreatitis. And the thing, I've got a bunch of friends that I drank with for years, and all of us started getting pancreatitis around the same time. All of us. I've had multiple friends of mine who have had pancreatitis now at this point. Multiple. And like I said, all of us around in our 40s all started ending up with pancreatitis all around the same time. And all these guys are all the same age as me. We all started drinking around the same time. We all drank together. And then in our 40s, we all started getting it. And we have all had health complications since because of having pancreatitis. A couple of my friends, each and every single one of them that got pancreatitis ended up with diabetes after getting pancreatitis as well. And we all had pancreatitis in the past and didn't get hospitalized for it because we thought we were hungover or something, but we ate bad or whatever. We had all had pancreatitis multiple times and didn't go see a doctor or a hospital, which caused us major problems in the back end. So once again, if you think that you have pancreatitis, please go see a doctor or go to the hospital, because they can help you out tremendously and prevent it from moving from acute pancreatitis to chronic pancreatitis. I had pancreatitis so many times. I remember one time we had just got new refrigerators at my job. We had moved them in there, and I woke up in the middle of the night one night. My back was hurting so bad. I actually ended up getting out of my bed and laying on the floor, thinking that I'd hurt my back moving the refrigerators. That's not what it was. It was pancreatitis. I was throwing up. I was sick for days. And here's another thing, too, that I used to do. And please do not do this. I would get pancreatitis, and I thought that I was just like really hungover, and I'd hurt myself because I felt so. I used to throw up every single day when I wake up in the morning, every day. So I'm thinking, okay, this is just a really bad hangover, and I hurt my back. So what do you think I did when I had pancreatitis? I started drinking in the middle of pancreatitis. I was literally pouring gasoline on the fire. What in the world? I'm being dead serious. I remember one time, it was like Christmas or Christmas Eve or something like that. It was during the holidays. I'm pretty sure it was Christmas Eve. This was a few years ago. I had gotten all these bottles of liquor from employees at work. And one of the bottles of liquor that I'd gotten was a bottle of bourbon, which is something I never liked drinking. I just did not like bourbon. And I had gotten the bottle, but I was like, I'm going to keep it. I'll drink it if I have to, which it was like a backup, which, it'll get you there where you want to be. I just didn't like the taste of bourbon. So I had hidden this bottle of bourbon, stashed it away, ended up sick, super sick. And my wife took my kids over to my in-laws' house that day, and I had to stay home. I was too sick. My wife knew that I was not well, and she attributed it to my drinking and took all the alcohol out of the house. I had some beers in there. She got rid of them. Well, she left, and I remember getting up that day while she was gone and pacing back and forth in my backyard because my back hurt that bad. I just got up and started walking around, thinking that that might relieve some of the pressure on my back, not realizing I was in the middle of pancreatitis. Well, I went and pulled that stash of bourbon out that I had, thinking this will make this feel better. I thought that I was just really hungover. Started drinking on top of it. Straight bourbon. On ice. And things got worse. It did not improve my situation at all. It got worse and worse, and I ended up getting really sick, and it didn't start getting better until I actually just stopped drinking for a while, which is something I did every single time I got pancreatitis. We went to West Virginia one time to go visit with my family. I've talked about this with my wife's family. I got pancreatitis while we were up there. I had to lay in the bed for like 2 straight days. I was puking all over myself. I lived in the bathtub. I had to sleep with a heating pad every night. I stopped drinking, and we were still up there. We actually went to DC. We were in DC for a week while I was in the middle of pancreatitis, but I quit drinking, and it finally calmed down. But that's what it took. Every time that I would get sick was I had to stop drinking. And after I removed the alcohol, gave it about a week, didn't eat anything really, the pancreatitis would go away. I do not suggest trying to let it heal at home because it can seriously, I think all of the blood clots I ended up with, the blood clots in my portal vein, the blood clots in my spleen and all that stuff, I think that came from pancreatitis. Not exactly sure, but I think that's what it came from. You can end up with blood clotting. You can end up bleeding internally. The times I was in the hospital, now I don't know what the correlation was, but I was vomiting blood. Why my varices burst when I had pancreatitis, I don't know. I've never looked into why that happened. But I was vomiting blood. And I was bleeding internally. As soon as I got to the hospital, the first thing they did was start giving me blood transfusions. I went to the hospital the first time, I think my hemoglobin was like a 4.3 or something like that. It was super low. My blood sugar was 1100 when I ended up in the hospital with pancreatitis for the first time. The doctor looked at me and said, I don't even know how you're still even awake right now, because my blood sugar was so high. Something that everybody on this channel could do as well is that you can go to your local Walmart, CVS, Walgreens, any of those places, and you can buy a glucose test kit. They don't cost much money at all. You do not need a prescription to do it or anything like that. Go to your local Walmart or any of your drugstore chains and go in there and go to the section where they have all the diabetes stuff. They have these little glucose kits. It's a little glucose monitor, and most of them have everything in it. It's got the lancer, which is just basically a little thing that you can prick your finger with. It comes with the little strips, and there'll be like 30 of them in there, and the reader, and a little case to carry it in. It's like $15 for a blood glucose monitor. You prick your finger. You want to make sure you clean it with alcohol first. Dry that off. Do not check your blood sugar because the alcohol can make your blood sugar seem off. So you want to make sure that alcohol is cleaned off, and then squeeze the finger, get the blood out, and then once you get a nice little pool of blood on your finger, take that little test strip, stick it into the device, and then you just touch the strip to the blood, and it'll give you an instant reading. It takes like 3 seconds, and it'll tell you what your blood sugar is. Normal blood sugar, I think, is somewhere around 80 to 100, somewhere in that range. If you haven't eaten, and I don't know these numbers right off the top of my head for normal people, but if you check your blood sugar, if you think you're in the middle of pancreatitis and you check your blood sugar and it's saying if you haven't eaten all day and your blood sugar is like 350, 400, 500, something like that, you need to go to the hospital. And that's a super simple way for you just to know. Now, I'm not a doctor. I'm not affiliated with any healthcare professionals. I'm just a normal guy who's had pancreatitis. And I'm just, saying things that, I've been through, and this might be an indicator. And I'm not telling you this is going to tell you if you have pancreatitis or not, but it might help you go, I definitely need to go to the hospital. If you get one of those finger pricks, check your blood sugar, and it's through the roof. A simple Google search will tell you what normal blood sugar is supposed to be, and you probably could look up and see, what it might be if you're in the middle of pancreatitis. But if your blood sugar is 500, you need to go to the hospital, because there's something seriously going on with you. Either you're a diabetic and your blood sugar's through the roof, or you have some serious pancreas problems, which all have to do with your pancreas anyway. And the thing is that, pancreatitis, I promise you, it is so painful. I've been in tears with pancreatitis. Can't sleep all night long because your stomach hurts and your back hurts so bad. You can't eat anything for a long period of time, and when you finally do get a chance to start eating again, it's not like you can just go back to eating the way you did. You have to eat soft foods like, Jello and pudding, and you have to watch your fat intake. You have to eat very low fat, because if you eat too much fat, you're going to end up in a pancreatic attack and your stomach's going to hurt. I made the mistake one time of eating chicken wings, and oh my gosh, I thought I was going to have to go back to the hospital. Now, I made it through the night and then went to my doctor actually the next day and told him what happened. He said, man, you cannot eat chicken wings. You just can't. There's too much fat in them. So now, still to this day, I have to be careful about the amount of fat that I eat, the amount of sugar that I eat, just everything, because I don't want to end up with another pancreas attack. It's not fun. It is one of the worst things about this. I promise you, it is not something that's just like, okay, well, I had pancreatitis, no big deal. No, if you end up with pancreatitis, I promise you, it's going to scare you to death. Literally, because you might lose your life from it. And if you don't, you're not going to want to get it again. Once I got pancreatitis, I tried quitting drinking over and over and over and over again. I mean, I quit and relapsed over 100 times. I got pancreatitis, ended up in the hospital. That first time, that's all it took for me. I went through a medical detox, but once I did that, I said, that is enough. I can't go through this again. It's not worth it. I do not want to end up in the hospital again. And let me tell you something, being in the hospital for 2-3 weeks, it's not fun. It is boring. The food is horrible. And if you're anybody like me, I can't stand bad food. I mean, I'm a foodie. My whole life I've been. And I have to, I can't eat what I want anymore, but I don't want to eat that trash. I mean, I'm sorry, but hospital food, and for anybody that might work in a hospital, I'm sorry, but I mean, your hospital might be different, and you might have decent food there, but I've been to a bunch of them. I've never had a good experience with hospital food, not once. It is trash. The food's never hot, it's always cold, it's not seasoned, it's right out of a number 10 can. I mean, it's just not good food, and the last thing you want to do is sit in a hospital for 2 weeks and eat hospital food. I can promise you that. The best meal that you're going to get for the day is breakfast. The other meals, I mean, I refuse to eat it. I just wouldn't do it. I mean, unless somebody brought me something to eat, I mean, for the most part, I just drink protein shakes and ate Jello and pudding. But I wouldn't eat the hospital food. Now, breakfast time, I would eat it if I was allowed to eat, because the breakfast normally at most hospitals is pretty decent. But that's the only meal that was any good. And 90% of the time, I wasn't allowed to eat. I was always starting off the day MPO, because they were saying that I'd probably have to have surgery that day. So I always missed breakfast. Or I had to go do some lab work, or they had to go take me for an MRI, or the doctor, I'd get my breakfast, and then the hospitalists would be doing their rounds, and they'd come into the room as I got my breakfast, and it would get cold because they don't care. They have a bunch of patients to see. I mean, it's not like just because you're sitting there having your breakfast, like, they're going to go, oh, I'm sorry, you're in the middle of breakfast. Well, I'll skip you and come back. No, they're going to come in your room. And, when they start talking to you and feeling all over you, by the time they're done, your breakfast is cold. I'm telling you, it's just not a good experience. The bathrooms you do not want to have to go in those bathrooms. The showers, you can't take a shower really. Now, it depends on the hospital, but for the most part, they just have like a shower thing on the wall. The whole bathroom is a shower. So if you take a shower, you're getting everything wet. Toilet's getting wet. Toilet paper's getting wet. The floor is going to be completely soaked. It's just, I'm telling you, being in the hospital is not fun. It is not fun. And I've spent over 2.5 months in the hospital over the past 2 years. And I can promise you, I do not want to go back unless I absolutely have to. But when I'm in the middle of pancreatitis, there's no option. It's not like I go, okay, well, maybe I'll go if it gets worse. No, when I know that I'm feeling like I got a pancreatitis, I go. I do not skip go anymore. I just go straight to the hospital because I don't want to deal with it anymore. I'm not going to deal with that at home. I'm going to the hospital. I'm getting pain medication. I'm getting on an IV, and I'm going to get taken care of. And anytime I've had pancreatitis, I have internal bleeding. My varices burst. I'm throwing up blood because I would imagine probably what's happening is because I throw up so much when I have pancreatitis that I burst the varices, and that's why I'm bleeding internally. And once those varices burst, they just don't stop. And I'm on blood thinners right now, too. If I burst the varices, that's probably going to be it. My doctor's already told me that the therapeutics, the blood thinners, are probably going to be what takes my life before anything else. All it's going to take is for me to burst the varices. I'm on blood thinners. They're not going to be able to stop the blood. I mean, I'm going to keep bleeding. And I do everything I can to prevent from getting pancreatitis again. Although I have chronic pancreatitis, I get flare-ups all the time. There's times where I might have something with just a little bit too much fat, and I lay there in pure agony and fear the rest of the night while my stomach hurts, and I'm like, we might have to go to the hospital tonight. I don't know. And we both sit there the rest of the night, can't sleep because we're so worried that we're going to have to get up and drive to Charleston, because it's that important. It is life-threatening if you get pancreatitis, and you cannot get it. I'm not saying that you can totally prevent it, but you can prevent it by massive amounts if you stop drinking. Just stop. Or don't drink. If you've already stopped, just don't go back to it. Alcohol affects almost every organ in our body. It affects every organ in our body, basically. I mean, it causes damage to so many things, but our pancreas gets really damaged. Do you want to end up with diabetes? Do you want to have to take insulin shots 15 minutes before every single meal and count your carbs and carry your insulin pens around with you and needles and all that garbage and have to go to the endocrinologist once a month? I mean, insulin's not cheap, guys. It's not. And the diabetes medication they put you on, that's not cheap either. Having diabetes is expensive. And you can end up with diabetes because of pancreatitis. You do not want to end up with it. It is a headache, a massive headache. I wish I did not have it. I really do. I wish I could eat whatever I wanted to. I can't. I just can't. Like my doctor told me, you don't eat to live anymore, or live to. You don't live to eat anymore. You eat to live, which means every single thing that I eat, I have to be careful of what I'm eating, and you just don't want to deal with it. But anyway, guys, this video has gone on for 43 minutes here. I need to go ahead and get off of here. I know I've probably lost a lot of people at this point anyway, as long as this video has gone on. I think I might do a part 2 on this tomorrow, after I get everybody's comments and stuff that I left out in today's video, because I'm sure I left some stuff out. So if you have had pancreatitis, and there's something that I left out, please let me know in the comments. Things that you might have experienced that I didn't discuss today. I'd love to hear it so that I could maybe make a part 2 on this either tomorrow or some point, in the next couple of days, just to follow up with the extra information of things that I missed, because I really want to just make sure that all the information is here for people to know. Because like I said, this is why I've created this channel, for awareness, for education, for people to know, so that people are rightly informed. And if you start noticing any of these signs and symptoms, please go to your doctor or your hospital. I know it's not comfortable and I know it's scary, but trust me, it's a lot more scary when things go downhill because you didn't seek treatment. And if you end up like me with burst varices and you're throwing up blood, talk about scary. You do not want to be there. You just don't. So if you're looking for a reason not to drink today, this is a perfect reason why not to. And once again, if you have had pancreatitis in the past, or you have chronic pancreatitis, which I know I've got multiple subscribers on here that have chronic pancreatitis right now. One of the gentlemen that's on here, that's a subscriber, he's in the middle of dealing with it right now. So Let me know in the comments things that I missed, guys. Thank you so much for watching today. I really do appreciate it. And until tomorrow, I will see y'all then. Y'all have a great day, guys. I love y'all so much. Bye.